Pyogenic granuloma. What is this disease? What are its symptoms? Can it really cause cancer, or is it a type of cancer itself? Who are the people most at risk of developing pyogenic granuloma? What are the steps to treat it? And what are the most important instructions and tips that should be given to anyone diagnosed with it? Also, what other diseases or conditions can lead to the appearance of pyogenic granuloma? All of this and more in today's video. Stay with me. Peace be upon you. I'm Hussein Lutfi, and you're watching the Octopus Pharmacist channel. Welcome to a brand new episode of From A to Z Derma. Let's start with the outline of today's video. If you're interested in a specific topic, skip ahead to that part using the timestamps. But if you'd like to understand everything about pyogenic granuloma, stay with me from beginning to end. First, let's take a quick overview. As always, we'll begin by organizing our thoughts and learning the key facts about this condition. In medical books, pyogenic granuloma is called acquired benign proliferation of capillary blood vessels. Let's break this term down together. 1. Acquired. This means a condition isn't something you're born with. It develops later. Usually, it appears due to external triggers like wounds, cuts, scratches, itching or rubbing. Most people don't even notice the original cause. It might just be a small injury or irritation. 2. Benign. This is a key point. If your doctor says it's benign, that means it's not cancerous. It's non-malignant and doesn't spread like cancer. So, don't worry if your doctor gives you this diagnosis. 3. Proliferation of capillary blood vessels. This means there's abnormal growth of tiny blood vessels under the skin. So, why does this happen? Usually, it's triggered by trauma or injury. That injury releases certain proteins in the body, especially a protein called VEGF, vascular endothelial growth factor. This protein encourages new blood vessel growth. At the same time, cytokines, immune system messengers, get released, causing even more blood vessel formation. This same mechanism also happens during pregnancy, but in that case, it's mainly driven by hormonal changes, especially high estrogen levels, not external trauma. Where does pyogenic granuloma appear? It can develop anywhere on the body, on the hands or legs, around the eyes, inside the mouth, on the fingers and toes. Anywhere there's skin or mucous membrane can appear. Who's most at risk? The most common group affected is pregnant women, due to the major hormonal shifts during pregnancy. But again, anyone can develop it, especially if there's repeated irritation or trauma. Example, using a hard toothbrush can irritate the gums or inner cheek. This irritation may trigger VEGF and cytokines, leading to pyogenic granuloma in the mouth. How does it look to the eye and under the microscope? Visually, it appears as a small red, fleshy bump. It usually measures between 5 to 10 millimeters in diameter. It grows quickly, often within days or weeks. At first, the surface is smooth, but over time, with rubbing or touching, the surface becomes easily irritated or ulcerated. Why? Because the blood vessels inside are fragile. Even light friction can cause bleeding. How many can appear? There's no set number. Some people have one. Others may have multiple. It depends on the individual case. What does it look like under a microscope? Doctors see a very clear pattern. A red or pink ball, surrounded by white lines or areas. Most dermatologists can diagnose it just by looking at it, based on appearance and symptoms. Sometimes they use a dermoscope, a special tool to examine the skin closely. Very rarely, if there's any doubt, the doctor may take a biopsy, a tissue sample, to confirm the diagnosis. But in most cases, that's not necessary. The second topic in today's episode: what are the most common conditions that resemble or are often confused with pyogenic granuloma? Let's take a closer look at the two most common conditions that can look like pyogenic granuloma and how we can tell them apart. 1. Hemangioma. This condition is often called a bunch of red blood vessels, or sometimes described as red worms, like pyogenic granuloma. Hemangioma is also a result of blood vessel growth, but there's a key difference. Let's break it down. Hemangioma involves a mass of blood vessels growing together. It's a tangle of vessels. In contrast, pyogenic granuloma, PG, is a single abnormal proliferation of vessels. It's more like one main lesion growing out. So what does that mean visually? The size of the lesion in hemangioma is usually much larger than that of pyogenic granuloma. Another key difference, bleeding risk. Pyogenic granuloma can bleed very easily. Even a small bump or touch might cause bleeding. But hemangiomas don't bleed as easily. The blood vessels in them are deeper and more structured. Why does pyogenic granuloma bleed so easily? Because the capillaries inside it are thin and fragile. They're very close to the surface and break with minimal friction. Growth speed. Pyogenic granuloma appears suddenly, grows quickly, and stabilizes within a few days or weeks. Hemangiomas, on the other hand, grow slowly, sometimes over months. Diagnosis. If the doctor isn't sure, they can look at both lesions under a microscope. Their internal structures are quite different and easy to distinguish with the right tools. 2. Squamous cell carcinoma, SCC. Now, this one is very serious because unlike the previous cases, SCC is a type of skin cancer. Important rule. If the doctor suspects even 1% that what's in front of them might be cancer, they will immediately take a biopsy, a tissue sample, and send it for analysis. In this case, histopathology tissue analysis is critical and possibly life-saving. So, how can we tell the difference between SCC and pyogenic granuloma? Here are the main distinguishing features. 1. The borders of the lesion. In SCC, the edges are often irregular and uneven. In pyogenic granuloma, the borders are usually smooth and well-defined. 2. Surface appearance. SCC often has a rough surface and may develop scales or crusts. Pyogenic granuloma usually looks like a smooth, moist red bump, especially in the early stages. 3. Dermoscopy findings. Under the dermoscope, SCC often shows O, a yellow center, caused by keratin. O surrounded by a white ring. O then a light pink halo. This pattern is very different from the consistent red appearance of a pyogenic granuloma under the dermoscope. A very important question. Can pyogenic granuloma turn into cancer? The short answer is no. Pyogenic granuloma does not transform into cancer. But here's the catch. In rare cases, there may be a hidden skin tumor underneath the pyogenic granuloma. Here's what can happen. The lesion looks like a pyogenic granuloma. Even the dermoscope shows typical signs of PG. But underneath, there's a small undetected tumor, like squamous cell carcinoma. That's why some cases get misdiagnosed, and the cancer is discovered only later. So what's the solution? Anytime a pyogenic granuloma appears, especially if it's new, growing fast, or unusual, the patient must see a dermatologist. The doctor may choose to examine it clinically, use a dermoscope, and if needed, take a biopsy to confirm the diagnosis. Final advice. Although pyogenic granuloma is generally harmless and easily treated, it's still essential to confirm the diagnosis and rule out any hidden tumor. This step can make all the difference. Third and penultimate topic in today's episode. What are the most important instructions and tips a dermatologist should give to a patient with pyogenic granuloma, PG? Whether you're currently dealing with a case of pyogenic granuloma or have had one before, there are several key instructions you need to follow to prevent it from coming back or getting worse. Let's break them down one by one. 1. Hormonal causes, especially in women. Earlier, we mentioned that hormonal imbalances, especially in women, can trigger the formation of pyogenic granulomas. So here's what to keep in mind. If a woman is taking hormonal treatments, like birth control pills or hormone therapy, and develops PG, It's very important to stop the current hormone treatment under medical supervision and consider safer alternatives. For example, instead of pills, the doctor might recommend non-hormonal methods like condoms or hormonal alternatives like the IUD or injectables, depending on the case. The goal is to remove the root cause, not just treat the result. 2. Oral pyogenic granuloma. Linked to dental habits. If the PG appears inside the mouth, this is often due to irritation or injury from certain oral care habits. Let's go over the do's and don'ts. Avoid using hard or rough toothbrushes, brushing too aggressively, toothpaste with strong abrasives or strong mint flavoring. Do switch to a soft or extra soft toothbrush. Use a mild gel-based toothpaste. Choose toothpaste that are low in fragrance and abrasives. If you use dental floss, go for the wax type. It's gentler on your gums and helps reduce friction. Why all this matters. Friction and irritation in the mouth can trigger immune responses, releasing cytokines that stimulate abnormal blood vessel growth, leading to PG. 3. Dentures, fixed or removable. If the patient has dental prosthetics, whether fixed or removable, these can also be a source of irritation. Here's what should be done. The dentist must evaluate the dentures to check for any friction or pressure against the gums. If needed, the prosthetic may be adjusted or reshaped, lined with softer materials like wax or plastic, or even replaced. The idea is to prevent continuous irritation, which could lead to or worsen a PG. 4. Repeated friction on skin, a common trigger. Another major cause of PG is persistent friction or pressure on the skin. This can happen in many everyday situations. Examples include wearing tight accessories, glasses, headbands, or hats, rubbing from nose pads or earrings, friction around lips, eyebrows, or jawline. All of these can lead to minor trauma, which activates the body's immune system and triggers blood vessel growth, resulting in PG. So, it's important to identify and remove the source of repeated friction. 5. Don't try to remove it at home. Now for one of the most critical warnings. If you see a pyogenic granuloma on your body, never try to remove it yourself. Common and dangerous myths include, I'll poke it with a needle. I'll tie a thread around it until it falls off. I'll heat a needle or blade and burn away. These actions can cause severe infections, bleeding, scarring, or even make the condition much worse. Always remember, pyogenic granuloma may look simple, but only a dermatologist can safely confirm the diagnosis and choose the proper treatment. Final advice. Although PG is non-cancerous and usually easy to treat, it must still be taken seriously. Always identify and remove the cause, whether it's hormonal, physical, or dental. Avoid self-treatment. Follow up with your dermatologist to confirm the diagnosis and get safe, effective care. Fourth and final topic. What are the treatment steps for pyogenic granuloma, PG? So now the doctor has diagnosed it. It's definitely pyogenic granuloma. What comes next? How we treat it? There are 3 major lines of treatment, and we'll break them down in order, starting from the most conservative to the most interventional. Step 1. Topical treatments, non-invasive options. The first and most preferred choice, especially in mild cases, is topical therapy. And here, we have 2 main medications that dermatologists rely on. 1. Aldera cream, imiquimod 5%. This cream belongs to a group of medications called immunomodulators. What does that mean? It helps regulate your immune system and calms down immune overactivity, which is a core reason PG develops. Remember, we said earlier that cytokines, the immune system's messengers, trigger the abnormal growth of blood vessels. By suppressing those signals, imiquimod stops the process at its source. How to use Aldera. Apply once daily, 3 to 4 times a week, typically for 1 month or as prescribed. Leave on the skin for 6 to 10 hours, then wash it off. Only a small amount should be used, and any leftover in the packet must be discarded. It's not reusable. This medication can be used in children over 6 months of age. Downside: it's expensive, and some patients may develop skin irritation, but overall, it's effective and safe. 2. Timolol gel, 0.5%. Timolol is originally used as an eye drop for glaucoma. Yes, eye pressure. But topically, it works by constricting blood vessels and reducing blood flow to the PG. This effectively dries out the granuloma and helps it shrink and disappear. How to use Timolol: apply once a day for around 1 month, or until improvement is noticed. It's a safe, painless method, often used for PGs around the eyes or in young children. Step 2. Intralesional corticosteroid injections. If topical treatment doesn't work, the next step is corticosteroid injection directly into the lesion. Most commonly used: triamcinolone acetonide Kenalog. Why cortisone? PG is largely driven by an immune reaction, and cortisone is the gold standard for suppressing inflammation and immune activity. Injecting directly into the lesion shrinks it from the inside, often with impressive results. Dosing: around 2.5 to 10 milligrams of triamcinolone, diluted in saline or lidocaine. Injected using a fine insulin syringe, 10 units, directly into the lesion. Usually done once every 2 weeks, until the lesion flattens and disappears. Step 3. Surgical or physical removal. If the lesion is large, persistent, or unresponsive to medical treatment, it's time to remove it. There are 3 common options. 1. Surgical excision. A small procedure under local anesthesia. The lesion is cut out entirely and sent for biopsy if needed. Fast and definitive. 2. Cryotherapy freezing. Liquid nitrogen is applied to freeze the lesion. Quick and non-invasive. May need multiple sessions. 3. Laser therapy. Often the fastest and cleanest option. Uses precise light energy to destroy the lesion. Minimal scarring and downtime. Important note: these methods treat the existing lesion, but not the cause. Even if the lesion is removed successfully, if the underlying cause, like friction, injury, or hormonal imbalance, is still present, new PGs can appear in other areas of the body. So always remember, treating the cause is just as important as treating the lesion. That wraps up our complete guide to pyogenic granuloma, from A to Z. I hope this episode was clear, informative, and helpful. Don't forget to like, share, and subscribe to the channel. You can support us on Patreon, PayPal, or YouTube membership. Links are in the description. This was Octopus Pharmacist, and I'll see you next time with a brand new dermatology case. Good night and good health. Hussein Lotfi.